Right now we're going to do a day in the life of, and I'm going to give you some updates, okay? Missy, my 10-and-a-half-year-old lab that had lost her right kidney with cancer, she had to be rushed up to Gainesville because she threw some blood clots into a foot. University of Florida is doing some fantastic things with barometric chambers and getting oxygen into some of these cancer areas and stuff. So Missy's been up there for about 10 days. I'm going to try to fly up there Thursday and get her picked up. But anyway, I'll give you some more information on her in just a little bit. And a brand new emergency clinic opened up in Collier County. That's what you're going to watch for about 10 minutes of the show, okay? It's over, it's off of Collier Boulevard on 951 and Davis. We'll be able to show you the exact address, but you guys get ready. This is a really nice improvement for Collier County for people that need to have a specialist. One little advice, okay? When you guys are getting young dogs that you're just getting puppies, my suggestion is please pick up an insurance policy. You may need it, right?
Absolutely.
You may need it out there. But anyway, we're gonna look at this dog first of all. This is Nikki with a Y, and Nikki's got a lump on the side, right side. Where's it at, Dan?
It says it's right here.
Oh, come on, Nikki. Nikki's a fine dog right there. The reason I talked to you about Nikki with a Y is because my daughter's name is Nikki with an I. Yeah, that's interesting. Did he ever have any shots there, or ever have any get into a fight or anything there?
As far as I know.
All right, what I'm going to do is I'm going to shave this up, put a needle into it, and try to get some cells out of there.
Sure.
Look and see what it looks like, and snap a radiograph, make sure there's nothing inside there. All right, stay tuned. I'll be right back as soon as we get Nikki prepped for this exam. All right, we're going to see what type of cells we have there. Debbie, take it to X-ray. We're going to do a lateral, and we're going to do an upside down. All right, so there's no fluid that came out of there, but we'll have microscopic cells that we're going to look at and try to determine what type of a sample, what type of a growth that is, and see if it's fatty growth or if it's a bony growth. Debbie, you can take her on over to surgery that way. Perfect. All right, and getting a little stain and cover slip on this. It's really amazing. Well, you guys should know that from just CSI and NCIS as far as when they're doing forensics, as far as the information you can get off of just very small samples. And when you looked at this, you know, where you guys are at, it was almost as if there was no tissue there. There's no cancerous cells here visible. The only thing I see is a few red blood cells and a few fat cells. So hopefully it's just some scar tissue and a little bit of lipoma there. We'll go see what the x-rays look like. She's got some age with her, doesn't she?
She, what?
How old is she?
11.
Yeah.
She has arthritis?
Her right hip, the cartilage has actually shrunk away from it. She's had some type of injury on this right hip. She jumped off something and hurt it. The cartilage, let me see that sample back there, Shuggy, the hips. You've got a bone, like a chicken bone, okay? You got a bone with a socket on it. Okay, normal is a nice round head to the femur and it's in socket and moves well, okay? On this one, you're down to just bone to bone. There's none of that white shiny cartilage that you see on there. That's on the right side. So there's some type of ischemia that took place on the cartilage there. This one, you have an active inflammatory arthritic going on here where this joint is actually starting to close off and it's becoming calcified. And she's only 10?
11.
11, it's still pretty, it's pretty advanced hip arthritis. I mean, the rest of her looks really good. Maybe we'll quit looking for things, okay?
Yeah,
That'll make Mom feel a lot better.
I'm pretty sad.
Sugar, here's the hips over there. Make sure you mark on our card, the right hip is degenerative, left hip has arthritis on it, and You think just Orbax, one of the intrafloxacins? Or?
Well, it would be great, but I don't think
Oh, she was?
tolerate
Yeah, we gave her the shot a week ago of whatever you gave her last Monday.
Well, that was Convenia.
Yeah.
So that's one of the
I mean, you do
cephalexins.
convenient every 2 weeks, or
I'll do the
Clavamox.
pills, I don't care.
Clavamox gets really high levels in the renal tissue.
Well, it's one of my favorite ones if cats will tolerate it.
Yeah.
Okay,
She
the
can
cats will
tolerate
not tolerate Clavamox
Yeah.
oral
I
suspensions.
think I've given it to her already.
The pills are going to be much more, it's going to be slower absorbed, you're going to get more absorption from the pills.
Yeah.
Okay, if you can do
She's
that
had
and
it
stuff.
already.
What does she weigh, 10 pounds?
No, she's down to 5 something, almost 6, I think.
All right, so then we'll, sugar, start her off with, just go 2 weeks and we'll reweigh her. Start off with 2 weeks worth of Clavamox 62.5, 1 pill every 12 hours, and give it to her with food or give it to her with something, okay?
I had to put it in crush it and put it in moist food last time.
Nice,
Yeah,
nice.
no,
That's the way they like
that's
it.
a good mom.
That's how I gave my cats heartworm medicine for years.
Yeah?
Before they had all those topical
Yeah.
ones. I just take that heart guard and just smash it up and put it in there and stuff. But
Gotta do what you gotta do.
all right, thank you, Doc. Hi, I'm Dr. David Randall. Work at Big Cypress Animal Clinic on the East Trail. It's a member of the American Animal Hospital Association, a full-service hospital. We've got great receptionists, full-service exam rooms, lab right on the premises, x-ray, surgery, and a complete boarding service. You'll love it. If you stop in, we'll give you a tour. Come by at any time. 774-2233. Big Cypress Animal Clinic.
G'day. Does your dog have a nickname? If your dog's behavior keeps you inventing new nicknames, remember this name. Barkbusters, the world's most trusted dog trainers. They'll transform your dog into a happy, obedient companion in just 2 hours in your home and provide a lifetime guarantee. Rate your dog's behavior at barkbusters.com. Barkbusters, training dogs the Aussie way.
Welcome to Animal Specialty Hospital of Florida. We are a brand new specialty referral hospital and emergency center that is open 24 hours, 7 days a week, 365 days a year. My name is Dr. Michelle Carnes. I'm a board-certified veterinary neurologist.
My name is Dr. Mark Havig. I'm a board-certified veterinary surgeon.
My name is Ashley Ayub, and I am board-certified veterinarian in internal medicine, critical care, and emergency.
Now we'd like to take you back and give you a tour of our exciting new facility. What you see here is our MRI machine, or what stands for magnetic resonance imaging. MRIs are very important in the diagnostics for neurological patients. MRI imaging is useful for looking at the soft tissues, specifically the brain and spinal cord. In neurology, one of the most important diagnostics we use is MRI as well as CT scanning. What we can look for is things like herniated discs, problems in the brain such as brain tumors or encephalitis. Because our patients are animals, they must be under general anesthesia. Gypsy is going to have an MRI, but first what she would have to do is be anesthetized, and then she would be put into the machine. The scan takes about 45 minutes, and then the images are produced electronically and sent to the computer, where they are then analyzed by myself, the neurologist, or also we have the capacity to send them out to a board-certified radiologist. We are the only hospital in the whole Southwest Florida corridor that has a high-field MRI. As a matter of fact, this exact machine actually was removed from a human facility 2 months before installation and came all the way from Washington State. This is our CT scanning facility. CT scan, or what used to be called CAT scan, is an important imaging modality for neurology as well as other disciplines. CT scanning is most useful for evaluation of the bones and joints. It is a very rapid scanning tool and allows us to get very detailed diagnostics. For a CT scan, an animal must be either sedated or under general anesthesia because they have to be completely still. It is, however, a painless procedure. These patients will be evaluated for problems with the spine, sometimes acute head trauma, and we can also evaluate the abdomen or the chest and lung areas. This is the same type of machine that would be used for a human patient, and as a matter of fact, it was pulled from a human facility as well just before installation. Welcome to our neurosurgical suite. As a board-certified neurologist, I also have extensive training in neurosurgery. At our hospital, I do all of the neurosurgical procedures as well. The most common types of procedures I do are spinal surgery as well as brain surgery. For spinal surgery, one of the most common things that we see in animals are herniated discs, where a patient may come in paralyzed. In many cases, those patients can then, after having surgery, have been restored to full function and be able to then walk again. In addition, I do brain surgery as well. In those cases, some things that I may be evaluating for or doing surgery on are the possibility of brain tumors. Nowadays in veterinary medicine, we are quite advanced where we can remove tumors from animals' brains and they can then go on and have a very good quality of life. Now what we're going to do is introduce you to Dr. Mark Havig, where he'll show you the types of surgeries that he performs.
Hi, I'm Dr. Mark Havig. I'm the surgeon here at Animal Specialty Hospital of Florida. This is the anesthetic prep room, and this is the area where we anesthetize or initiate anesthesia in our animal patients. We've got central oxygen, vacuum, and scavenging systems throughout the building, and these are what the tubes are coming down from the ceiling here. Over here we've got our endoscopy tower, and this is basically a piece of equipment that allows us to do minimally invasive surgery, either looking through a scope into a joint or one of the major body cavities like the abdomen or the thorax. We can now head on back into the operating room and we'll look at the OR itself. This is another one of our operating rooms at Animal Specialty Hospital of Florida. We're fully equipped to do all types of surgery here, including minimally invasive surgeries that typically have been used primarily in people and not very common in the veterinary world outside of university practices. This operating table itself is a radiolucent operating table, which means we can shoot real-time live fluoroscopic x-rays during surgery, which allows us to do a lot of the minimally invasive stuff that's very advanced and cutting edge. That's about it for our operating rooms. Next we'll go back to Dr. Ayub, who's going to show you the emergency room as well as the intensive care unit.